I'm a proponent of nothing less than a 60-minute adult Prophy appointment. There is just no way to maximize preventative medicine in a dental practice with appointments shorter than that. I'm also a big proponent of assisted hygiene. Not accelerated, but assisted. I worked the majority of my career with a dedicated assistant. We will talk more about that in our assisted hygiene class. Before we talk about time management of a true preventative appointment, we all need to be on the same page as to what a Prophy patient's mouth looks like. In 2011, the American Academy of Periodontology said, a healthy periodontium is characterized by the absence of inflammation. I myself would add no significant deposits. But yes, they can have some, but no bone loss and no clinical attachment loss. I would add the patient doesn't have any significant deposits either. Some deposits of course, but no bone loss and they wouldn't have any clinical attachment loss. And little or no bleeding, but a little bit's okay. If we all agree to that and to the 60 minutes per adult patient, then to manage your time, divide any true Prophy appointment into thirds. The first 20-ish minutes should be dedicated to data gathering. I say ish because some people take longer than others, but the longest it should take should be 20 minutes at most. Data gathering would include finding out the patient's chief complaint, all the x-rays that are needed, an exam with an explorer, probe readings taken and documented. All of these probe readings would be within normal limits because we're talking about a Prophy appointment. Side note, don't forget at this time to make sure you congratulate the patient on the assessment of health and to keep up the good work at home. Then let them know that you will check on the gum tissue again in 6 months because gum disease can come on quickly and painlessly. This will build value in the periodontal exam, even for the healthy patients. Second side note, get help to record the probe readings. You cannot collect all of this data in 20 minutes or less without a team member helping you. Assistants, administrators, please help with this if you can. It can save 10 or more minutes when we get your help. If you don't help, the quality of care will taint. If you skip corners on data gathering, you're gonna miss possible high production opportunities in soft tissue management and restorative procedures. So don't skip on the data gathering. Get it done and get it done right. Make teamwork a priority here. Next, I highly recommend the use of a Diagnodent or So Pro Life for 2 reasons. Number 1, it objectifies any caries and puts a number on it, which builds trust from the patient. And then number 2, if you document the scores, you will be protected from insurance companies that might audit you for doing too many occlusals or too many sealants, which has happened. So record your scores. Next, the intraoral camera. If you don't have one handy, you will never have time for this. But if there is one in the hygiene room, it will pay for itself very quickly. And again, it will build trust. For as Dr. Gordon Christensen says, when they see it, they believe it. As a hygienist, I quickly had the patient watch on a large TV monitor as I scanned the mouth. If either of us had a question, I snapped a picture of it and stored it in the patient file, and then had the doctor look at it. You will be amazed how involving the patient in this will increase case acceptance with everything. There is a direct correlation to the percentage of case acceptance in practices with how large their TV monitor is in their operatory. If you've got a huge flat screen TV in there that you can show a tooth on with your intraoral camera, their case acceptance is higher than someone with a really small monitor. So take that tip into account with everything that you're presenting to the patient. Next thing, as a hygienist, I took a look at the x-rays myself and anything I had questions about from those x-rays or from any of the other data collections, I wrote my findings down on an exam form. It is critical you don't lose anything in translation during the exam. The form I used is free in our downloadable section. That's the first 20-ish minutes. Do not skimp on this. First things first, a diagnosis of perio or the chief complaint or any high priority treatment could slip through the cracks if you don't do this first section of the appointment right. You'll be tripping over dollars to pick up dimes if you don't make data gathering your highest priority in this appointment. The next 20-ish minutes should be preventative scaling and polishing and flossing. While you're working, preheat the patient to what might need to be discussed during the exam. This will prevent the doctor from taking too long with the recall patient exams. During the discussion, while scaling, let the patient know that the doctor will categorize any treatment into urgent, preventative, and cosmetic categories. Urgent would be anything broken, infected, or decayed that will get more painful and expensive if delayed at all. Preventative is anything that would prevent future urgent procedures, and the patient can decide whether to go ahead or not, or wait on those procedures. Then cosmetic is anything that the patient would be interested in to make their smile look better. If the patient patient has any questions, the answer is we can help you with that. Make it easy for patients to do business with you. Also, use language to prevent diagnosing as a hygienist or assistant. You know plenty. And if you have worked for your doctor for a long time, you know exactly how he or she would treat a tooth in any given situation. But to play it safe, use the phrase, the doctor might want to do a crown on that tooth because I see X, Y, and Z. But let's wait and see what the doctor thinks. This allows you to talk about the benefits and risks of any procedure the patient might benefit from without diagnosing. This is critical to keeping the doctor's time short for the exam. If you're taking longer to scale a patient than 20 minutes, it is not a true prophy, or you're not using the right tools. We will go into that more in our perio classes. I know COVID has slowed us down. Don't worry, like with any change in dentistry, you'll get back to your new normal, and you'll get back to your normal speed soon, so hang in there. The third or last 20-ish minutes of a true prophy is a very efficient exam, which in our class 4.3, you will find all of the things you need to know to get an efficient exam done. I am confident that you can stay on time and do a very good job in 60 minutes for a healthy patient if you stick to these guidelines and the exam process in 4.3. If you have a problem running behind, ask yourself these following questions. Am I the hygienist talking too much about non-dental subjects? Do I allow the patient to talk too much? Am I getting the help I need for perio charting? Am I as a hygienist trying to do more than a prophy in an hour? How efficient are the doctor and I at exams? Are your rooms properly stocked, or are you constantly running to get what you need? What is the system to communicate with your team members? Do you use radios, a system on your software, or run room to room to room? If it's not one of the first two, you are going to have a problem running behind. Are you trying to do financial arrangements or schedule in the operatory when the admin team can help you with that? Do you need help with documentation? Chances are, if you're running behind, you're having trouble with one or more of these things. Get what you need to make the hygiene department a win for the patient, a win for the hygienist, and a win for the practice. That's it, guys. If you have any questions about time management of a healthy patient, shoot me an email.